Welcome to the final presentation on Unit 4, Principles of Exercise, Fitness and Health. Topic for this webinar is exercise contradictions, okay? And what that means is when we look at working with a special population and we make a contradiction to key safety guidelines to make sure that those particular people are going to be safe. And when we say special populations, we mean people who are, don't want to say different to normal people, but it's somebody such as an elderly person, a child, someone who's pregnant, someone who we need to make a special contradiction for so that they're looked after during the session and that they stay safe. Learning outcomes for today are going to be to describe exercise contradictions and key safety guidelines for working with older people. We're going to be able to do the same thing for pre and postnatal, so people who are about to have a child or have just had a child. We're going to look at how to work safely with disabled people and also how we can work with young people, so those that are aged between 14 to 16. We're going to kick off by looking at exactly what a contradiction is. And contradictions exist whenever there is an increased risk of harm in any given activity, and that could be because of the person's age, could be because of their ability, and when we design a program, we need to follow a special program for these groups to make sure that they're going to stay safe. So let's look at our 50 plus first of all. So this is people who are a little bit older, and to reduce the risk of these people becoming injured or having a bad experience when they exercise with us, we should follow these guidelines. So to reduce and minimise the risk of adverse age-related cardiovascular and articular system events, the following guidelines should be followed. So we need to complete a health screening questionnaire, especially with everyone who's 15 plus. We should be doing that all the time anyway, but in particular when we're working with this age group. And when we do the warm-up, we need to warm up more steadily and more gradually. And that's because these people, they're 50 or over, and they need a little bit more time to get warmed up and to stay safe, and therefore we need to warm them up a little bit more gradually. Same thing with the cool down. We need to cool them down in a little bit more of a structured way. So don't finish the session right then we're doing 2-minute cool down. No. Stay with them 10-15 minutes cool down, nice and gradually. And we need to keep the intensity of all the training to a health related level. So we don't really want to be pushing these people into sort of 85, 90, 95% of their maximum heart rate. We need to look after them, keep them in that health related level where they're going to be nice and safe, maybe 60, 70% max heart rate, absolute max, to make sure they're going to be safe during the session. Okay, let's have a look at this one. So, additional safety guidelines when working with clients that are age 15 plus. Definitely need to ensure they have correct technique. So it's even more important for injury prevention with this client group because their muscles might not be as strong as they used to be. Bones might be a little bit more brittle than they were in the past. So make sure that they're using the correct technique and they're not putting any undue stress on any other muscles or joints that they shouldn't be. They need to be using the correct technique. So if they're doing a squat, for example, they really need to be nailing that squat and in the correct technique. You don't want them leaning forward and putting stress on the neck or putting too much stress on the lower spine, because they're going to really feel the benefits, feel the effects of doing that as compared to a younger person. You also need to give them more time to transition between activities. So if they're on the floor doing a press up, for example, they're going to need more time to get up and stand up and move to the next exercise than someone else who's maybe a little bit more able than them. If it's necessary, we can look to simplify exercises. So let's take the press up, for example. We might not do a full press up. We might do a box press up so that person's more supported. And we might begin new exercises in an easiest position and then lightly put on the resistance. So, you know, if we're doing something like, a bicep curl, let's practice it at a real low weight, make sure they're safe with it, and then we'll start to add on some weight from there. And we need to avoid extreme spinal flexion. So, you know, that's not going to be safe doing that with an older person, flexion at the spine. So let's try and avoid that wherever possible. Okay, so now let's have a look at pre and postnatal clients. So prenatal is when just before you're going to have a baby, and postnatal is after the period where somebody's given birth. And this information relates only to normal, healthy adult women experiencing normal, healthy singleton pregnancy, or have had normal, healthy birth, and have had previous normal, healthy pregnancies and births. So, you know, if someone has got some kind of complication going on, if they're having twins, if there's been a medical problem during the pregnancy, probably going to be best if we don't work with them. They're going to need a specialist to take care of them, because last thing we want is to jeopardise either the health of the mom or the baby. So here's some of the things that we do need to do when we're working with pre and postnatal clients. So women who have not exercised prior to pregnancy should begin with 15 minutes continuous aerobic activity, increasing gradually to 30 minutes. All right, so start at that 15 and then we'll work up to 50. You know, they might have been doing a lot of exercise in the past, but imagine the stress that the body's been under. Let's take things gradually and make sure that they're safe. Start off with that 15 minutes and then we'll move up to 30 as we go on. Pregnant women should maintain adequate hydration during exercise, and if it is very hot or very humid, then we really, we don't want them exercising. So make sure there's a nice big bottle of water for them to have during exercise, and make sure that they're eating enough calories as well. It could be the case that pregnant women tend to lose their appetite and don't eat as they normally would. So just check with them when they're coming to the gym. Ask them what they've eaten today, and if possible, if you've got a food diary, that would be an excellent way to track that. Exercise sessions should be no longer than 45 minutes, and we need to monitor the intensity according to how they are feeling, and we can use the talk test to do that, which we know about. Things that we should avoid. So, exercising in the supine position after 16 weeks. So remember, supine position, that's sort of flat on our tummy. So we want to avoid doing that after 16 weeks. Prolonged motionless standing, all right? We don't want these people standing up for a long time. If possible, let's get them in a seated position, and let's look after them and make sure they're not standing up supporting all that extra weight that they've got to carry around. Heavy, uncontrolled, isometric or prolonged resistance work above the head. So all of these things are going to increase blood pressure, and that's what we don't want to do. So we do not want to increase blood pressure through really heavy lifting, through isometric contractions or long resistance type workouts. Leg adduction and abduction against the resistance. This should be avoided because of there's something called relaxin in the body, which is a hormone that makes the joints a lot more looser in preparation for childbirth, and we don't want a joint to slip out or anything like that. So avoid that work, particularly working against the resistance on the legs there. Isometric contraction we've covered. We don't want any loaded forward flexion, and we don't want any rapid changes of direction or position. We need to be sensible here. We need to look after the baby, keep things under control, make sure the correct technique's being used. And we definitely don't want to be falling over or, risking falling over and therefore hitting the abdomen area. So keep it controlled, walking around the facility, not running around, not speeding around. Make sure all of the weights and things are cleared up. There's nowhere that anyone's going to trip over. an exercise should stop if any of these occur. All right, so dizziness, faintness, nausea need to stop straight away. Bleeding definitely need to stop. We need to probably get on the phone to a GP or ambulance in that case as well. Any contractions or abdominal pain, same thing. All right, we need to stop, and we need to get that sorted out. If there's any unexplained pain in the back, pelvis, groin, buttocks, we need to be stopping. And if the client gets very short of breath or has anything like chest palpitations, we need to be stopping. We need to be extra careful around pre and postnatal people because they are carrying another child, and we do need to make sure that they're going to be safe. Okay, let's have a little bit of a look at working with some disabled people. So when considering the limitations and additional safety guidelines which may be required to program design for a disabled client, the instructor needs to appreciate that because of the various kinds of disabilities, describing specific components of an exercise prescription for each condition can be difficult. So essentially what we're saying here is there's no one size fits all approach. There's going to be different things we need to do dependent on the disability. And to give you some examples, we've got things like physical disabilities. So if someone has very, very unfortunately lost a leg or an arm or part of their body, we can maybe work around that. And if someone's lost an arm, then we'll look to do stuff or exercises that work on the legs or work in the arm that they currently have. If someone's maybe in a wheelchair, we'll look to use facilities and equipment that they can access whilst they're in a wheelchair. We've then got things like spasticity. That's when muscles are very, very tight and there's not much flexibility there at all. We then have neurological conditions, so stuff that affects the nervous system and the ability and the way people think. Or it could even be something like depression. If someone's very depressed, they could even find it difficult to be in the gym environment, and we'll need to look to maybe not so much adapt the exercise that the person does, but adapt the environment that they're in to make the session accessible for them. And let's have a little bit look at some of these in a bit more depth, okay? So we have progressive disorders. So that's something like multiple sclerosis. And, I'm not progressing to be an expert in multiple sclerosis, but this requires careful monitoring to ensure that the exercise program is not causing the condition to worsen, all right? So we need to make sure that, and we could do regular fitness testing to be aware of this, or if it's a young person or someone who has a carer, we need to be speaking with the carer to make sure the work that we're doing is not making the condition worse, that they have still got the correct amount of flexibility in the body, they're still able to move and get around as they should be, or as they were before they came to us at the very, very least. Asymmetrical weakness. So if there's a difference in strength between the left and right side of the body, that could be caused by something like cerebral palsy or having a stroke, then we should be aiming to improve the effective size as much as possible, but you still don't want to neglect the side that has been working. So, we might be looking at some rehab work at first for the side of the body that's been affected, and then progressing and looking at equaling out and balancing out the strength in each area of the body. As we said, spasticity or spastic muscles are very tight. Although flexibility training can be extremely beneficial, before incorporating any flexibility in a program, the instructor should seek authorization from a suitably trained medical authority. So if someone has got that, I'm sure we can all think of exercises and tips and stretches that can aid flexibility, but you need to get that checked off with their medical professional first to make sure you're supporting them in the right way. We then have some neurological conditions, so that's something like muscular dystrophy. That's when muscles become weaker as a result of the central nervous system not functioning in the correct way. And the program should therefore focus on general fitness levels, not specific strength type training, because those muscles are going to get weaker and not work as maybe as they should. So let's look at making that person as healthy as possible. If there's any rapid decline there, then we need to get onto the GP to make sure that they're safe. Last couple, damage to sensory nerves. So this can occur with many types of physical disabilities and may result in an inability to detect pressure against the skin. Left untreated, it can result in a pressure sore. So although the client will already be aware of the importance of frequent checks, the instruction should make the client aware that the use of gym equipment may also bring about similar associated risks that require extra vigilance. So, if someone can't, if their senses aren't working and they can't detect pain, then you need to be careful, because they could be doing stuff that's really damaging the body, but they can't sense it. So let's keep it health related. Let's look after them and get those regular checks in and make sure that they're supported throughout the workout. Depression. Depression's quite common, I think, as we all know nowadays, and it could cause someone to drop out of a program if they've already started. It could mean that someone's uncomfortable working around other people. So let's take the steps that we can to make them happy. If they need to exercise in private, let's try and make it in private. If they do need time away from the program, let's support them, maybe with some home workouts if possible, while they're away from the gym, and continue to work with them as much as we can. Final group that we want to look at today is young people. And when we design a fitness program for young people, there's a range of things that we need to consider. We need to look at growth-related issues. So that's things, like if someone is getting older, getting stronger, and there's a lot of growth going on, the bones are starting to get longer, what do we need to think about there? We've also got flexibility and the amount of movement possible at each joint. We've got the stage of anatomical, physiological development, which we'll look at a little bit more. We've got the suitability of the equipment. Does it fit them? Is it appropriate? And we've got appropriate training goals. So let's have a look at this a little bit more. Ooh, okay. So when someone's growing, we should be avoiding excessive training, okay, including playing too much of one sport, playing the wrong sport for their body type, and using too heavy weights in resistance training. So to look at it in a little more depth, playing too much of one sport, and there's a couple of issues with playing too much of one sport, and it depends why they're playing it. If someone really loves that sport and they're playing it and they're happy, I don't see a problem. I know we've got the active IQ slides up, but I don't see a problem in that. If someone's happy, let's let them be happy and continue with the activity. If they're playing the wrong type of sport for their body type, however, it's maybe a different issue. If we've got a little tiny lad who absolutely loves rugby and he keeps getting battered every week by some of the bigger lads, what can we do to help him? And I'm not saying that he shouldn't play rugby, but maybe he should be playing tag rugby and avoiding contact. That would maybe be safer for him if he's having too many knocks and injuries. So just be aware of that, and to make sure the activity that they're doing is not causing them any harm. And then we've got resistance training. Resistance training's a controversial subject with teenagers and young people. Normal guideline is to maybe just stay with bodyweight type exercises up until the age of 14, and then to move on to some lighter weight. Depends on the individual. Some people grow faster than others. And if they're ready, they're ready. But personally, I'd say stay with people that are aged 14 to 16. They probably want to be looking at doing minimum sort of weights. And then after that, once they're a little bit older and a little bit grown up, they can then look to get onto some of the heavier weights. We also need to remember that there's a difference in gender, and there's different stages of development within each sex. So women are going to develop a lot more quickly than men, and we need to be aware of that. So normal puberty for girls is going to come in a little bit earlier than some of the boys, and they might be able to start doing some more advanced stuff. Also need to remember, and it's a bit strange, that some women or girls will be stronger than boys because they're bigger, and especially in the ages of maybe 10, 11, 12, 13, need to be aware of that. And that really sort of ties in quite nicely with appropriate size matching. So, anything where the size of the person or the young person is going to influence them getting injured or hurt by working someone considerably bigger or stronger, try and put them in equal groups. We also need to avoid excessive stationary high impact moves. We also need to teach an appropriate warm up and cool down, as we always would, and we need to provide appropriate protective equipment where it could be needed. Let's have a little bit of a look at flexibility. So, caution should be taken when teaching any strength exercise, especially during growth spurts, since as muscle growth does not keep up with bone growth rates, the soft tissue around the joints is already stretched, leading to increased injury. All right? And really, just to break that down a little bit more, what we're saying is, as growth happens, the soft tissue around the joint is already stretched, and we don't want to stretch it anymore and increase the risk of it being injured. So, I'm not saying that young people can't do stretching and flexibility work, but if it's real sort of intense stuff, like you'd imagine doing maybe in a gymnastics session, that needs to be carefully monitored. If it's a general warm-up and cool-down, and I don't see any problem with that. Okay, let's have a look at this. So we've got the anatomical and physiological development. So let's have a look at the cardio system. Some children have a smaller heart and a higher heart rate than an adult. So because they've got a smaller heart, their heart has to work really, really hard and really fast to pump the blood around the body, and therefore we don't really want them getting up into massive, real high heart rates. Keep it sensible. If you see them, it leads on quite nice to the next point. If they are very hot and very red, we probably need to stop the activity because it's not going to be safe for them. And we need to make sure that they're adequately hydrated and that the warm-up needs to be a bit less intense than it would be with adults because, again, they have got that smaller heart and they're more prone to having a high temperature and becoming dehydrated, and therefore I need to make sure they stay hydrated throughout the activity. So then what we've also got to look at is the size of the equipment that the person's using. So in the gym, the resistance machines are generally too big for young people. So what that means is the use of free weights is much better, because if you imagine putting a young person in a shoulder press machine, they're not going to be able to reach it properly and use it in an effective way. They're going to be stretching and reaching and putting the muscles under undue stress. When we use free weights, we can monitor their technique in a much more safe way and make sure they're using the correct path of motion, and that we're not going to bring on any injuries that would be incurred when we work with a machine. We have training for power and bodybuilding, and I know we touched on this a little bit earlier on, but really maximal lifts and all-out strength work, that should be avoided. We don't want to be going in for that. If we want to be doing rep type work, so maybe 10, 15, 20 reps with some low free weights, that's fine. Along with really body weight and plyometric type activities. So body weight is stuff like sit-ups, press-ups, pull-ups, and then we've got sprinting and bounding. They're going to be a lot safer for the adolescent group. So last one, guys. Thank you very much for watching. We should now be aware of the exercise conditions for 50 plus. For 14 to 16 year olds, our pre and postnatal, and working with disabled people. They're all very specialised areas and can require advanced training in the area. But really, you should have some building blocks now and some general knowledge on working with these special populations. Anything doesn't make sense, as always, drop me an email, give me a call or a text. Thank you very much for watching, and I wish you all the best of luck with the exam paper.